Hey guys, it's me, Damsel in Dystonia. Having a good night, so I thought it would be a good idea to do an update. I went and saw Dr. Zayas, my movement specialist neurologist, on December 13th for my second appointment, and it was a quick appointment. Good news is Wilson's disease wasn't, in fact, brain fog. I don't have Wilson's disease. Copper level, no problems with heavy metals in the blood, so that was all good. He believes that it is a functional dystonia, which is general dystonia. There's no brain issues as far as damage causing the dystonia. Cats jumping around. Yeah, so basal ganglia looked good. And that's the one thing that they say you can cause dystonia is issues with the basal ganglia within the brain. Mine's okay. But, so I pulled some research, of course, of what functional dystonia is. It's not functional as in I am normal. It's just called functional because this is general. I'm kind of confused on why it's called what it is. So, the Dystonia Medical Research Foundation has emailed me about services and things that they can help me with. So I pulled off their website as well as the Mayo. Dr. Zayas is referring me to the Mayo Clinic movement specialty clinic that they have in Rochester, Minnesota. Because as far as he's concerned, there's nothing he can do for me. Medication is not something he's recommending at this point anymore. So he's taken me off of the baclofen. Because it didn't do anything to help. It just made my skin burn and gave me blisters and made me talk in my sleep. I was kind of more in a daydream on it. It's not something I enjoyed. Okay, so from the Dystonia Medical Research Foundation, I pulled off the more, info functional dystonia information, and it's reverse I see in the camera, so I apologize. But anyway, so in functional dystonia, there is abnormal, unintended movement or positioning of the body due to the nervous system not working properly. Functional dystonia can cause movement symptoms in the face and neck, shoulder, torso, and or limbs. Functional dystonia is often seen in individuals with psychiatric disorders. I do not have any of those. And or exposure to psychological stressors. The onset of symptoms is often preceded by an injury, illness, or emotionally stressful event. So this is why I'm going to the Mayo Clinic. I do not have any psychiatric disorders. I am completely mentally stable. No psychological stressors that we are aware of. Of course, with your unconscious mind, there could have been one that I'm not perceiving. I don't know. And I have had injuries in the past. So they're going to look probably into that. I have been in a couple accidents. A car accident when I was younger, where I did damage my neck, and it's embarrassing to say, but about 5 years ago, I was going down a water slide, one of the space bowl kind, and at a park, and when I went around the space bowl part and went to go into the water slide part that shoots you down into the pool area. I went in kind of backwards, and when I went in backwards at like an angle, I got flipped so fast off of the inner tube that my chin hit my chest and I got knocked out, and the lifeguard had to pull me out of the water. I was actually unconscious for a few minutes, or maybe not even a few minutes, I don't remember. But ultimately I was okay. I didn't seem to have any kind of concussion type symptoms. I was fine, and I was okay the rest of the day, and didn't even really have a headache that I can remember. But I also have the starting stenosis in my cervical spine. And I've had back surgeries, and I've had CT myelograms in the past. I have 2 actually. I've had since I was 21. Several injections in my spine for cortisone, even in the cervical spine, for pain, because I've got degenerative disc disease. Some bone spurs in the cervical spine, and no cartilage in my shoulders and some of my other joints, arthritis. And I'm diagnosed with Ehlers-Danlos syndrome by my PCP, and am going to the University of Iowa. I've been twice for Ehlers-Danlos hypermobility. So with the functional dystonia, what my neurologist here is saying that he believes it is, he's not sure, 100% sure. That's why he's referring me to the Mayo Clinic, because the deal is, functional movement disorders in general, they're real, and they're very disabling disorders, or can be, in situations such as myself at this time. They are not deliberate. Patients are not making up symptoms. I've had somebody ask me, well, how can you type typing's not my speech. Typing is one thing that does not seem to aggravate it. Typing doesn't, my cat's wanting attention. Typing doesn't seem to trigger anything, but if I'm already bad, I can't type, and talking triggers it, so that's why as I record these videos I seem to get worse. Sorry. Functional movement disorders, patients not making up the symptoms, do not mean an affected individual is crazy or hysterical, although I might seem that way sometimes. They're due to dysfunction of the nervous system and not neurological damage or disease. And they are treatable, which is good. The cause, many researchers believe functional movement disorders occur due to an underlying vulnerability in the brain combined with an external trigger. Mechanism is not yet fully understood. We know in my family that my great-grandmother and my grandmother both had what we believe now was actually dystonia. My great-grandmother had it so severe that she could not function. And they said that then it was Parkinson's, but likely it was dystonia because her head was affected and she didn't have slow movements. It's in the past been confused because of the tremors. But the doctors are now very easily able to differentiate dystonia and Parkinson's. So The research suggests that the process in the brain that helps a person sense whether a movement is voluntary or involuntary has become disordered somehow. It's the unintentional movements or postures is what happens then. So what my neurologists explained is at the Mayo Clinic, basically they have specialists that work with you to retrain your brain. Don't know, again, why I developed it so suddenly, but it is actually common for it to be sudden onset, especially if it's in your genetic makeup. Functional dystonia is sometimes called psychogenic dystonia, which refers to the observation that many cases have psychological or psychiatric factors that contribute to the physical symptoms. Again, in my case, there's none that we're aware of. Was completely mentally stable, functioning very normally, helping other people, working professionally, and other than having, job duties that were quite cumbersome and busy at work, I could come home and completely detach from my career and be normal at home and calm and do fun things. And so we aren't really worried about any psychological factors at this point because we haven't been able to figure one out. Researchers are the human brain is, of course, complicated and an interconnected system. And the doctors also that are trying to treat these movement to reduce the movement symptoms don't fully understand why it's going on yet. The areas of the brain associated with the movement are also involved in cognitive, emotion, memory, and other mental functions. Researchers are actively studying functional dystonia and functional movement disorders to better understand the underlying neurology and improve treatment. Also, when I hold my breath, and you'll hear me read fast at times, it's because if I hold my breath, I don't shake as bad. It somewhat suppresses it. So, damsel in dystonia, what types of functional dystonia is there? Let me tell you. So, functional dystonia can affect different areas of the body. As you've seen from my other videos, it's my head and my neck, my shoulders, my arms, and my torso on me, depending on how bad I'm being affected at any given time. So it can share some characteristics with the dystonia due to other causes, but also has distinguishing features. Common expressions of dystonia, functional dystonia, include dystonia of the face. Really? I didn't figure that one out yet. And it's really annoying. It includes intermittent facial spasms, fixed postures, downward pulling of one side of the face, a mouth, symptoms come and go, normal functioning of facial muscles in between episodes. So there's going to be times where I look and can talk completely normal. Generally those times have been late morning, when I've been quiet all night, and the worst times have been early morning, late afternoon, or early evening, if I'm tired. And, how tired I am also affects it. Blepharospasm, I'm not sure if I pronounced that right. Individuals may experience sudden onset of blinking and or sustained closure of the eyes. Eye symptoms may affect both eyes or occur with spasms on one side of the face. I do get the blinking. My eyes will water and sometimes they shut all together for a few minutes. Fixed dystonia is another type. Functional dystonia often manifests as a fixed posture, typically in a limb, hand, neck, or shoulder. It should be noted that dystonia acquired from secondary causes, such as an injury, it may also be fixed. Functional dystonia with pain and dysautonomic symptoms. Is difference in skin temperature, skin color, sweating, or swelling. It may suggest complex regional pain syndrome. This is something that is new for me to read. Considering how I feel like I'm on fire at times and I get really nauseous and really hot out of nowhere. We thought that it was related to thyroid, so they tested that the thyroid was normal. So now we're adding these symptoms into the dystonia. There's times where my fingers and toes, and just my fingers and toes, will be deathly cold. And the rest of me will be like really hot. And not just because I'm cute. Like my husband says. Episodic dystonia is another type of functional dystonia. It's a functional dystonia that occurs in episodes or attacks, which is also a hallmark of movement disorders called paroxysmal dyskinesias. Episodes of functional dystonia can produce movements in the torso and limbs and may last varying lengths of time in the same patient from seconds to 2 days.